everyone, I am Praveena. Today we have an interesting topic about the latest technology in knee replacement with robotic system. Chennai's first 4th generation Whaley's Johnson & Johnson robotic system has launched at Prashanth Super Speciality Hospital. When we hear about robotic knee replacement surgeries, I'm sure you all will have several questions in mind. So did me. Like how we go about the robotic surgeries, how does it work, what's the advantage, other medical issues like which can encounter in future and all this thing. So today I would like to take this opportunity and use this platform to educate you as well to answer the questions with one of the leading orthopedician at Prashanth Super Speciality Hospital. Dr.Arumugam has performed more than 5,000 knee and hip surgeries across the world with almost 100% success rate. His patients ranges from young athletes to elderly patients who are suffering from arthritis. He's also got tons of testimonials to prove that he is the best orthopedic surgeon in India. To talk about his professional achievements, he's got a list of records. So I would like to highlight few among them. Consecutively for last 2 years, that is 2021 and 2022, he's been awarded by the Time Health Excellence for the Service Excellence Orthopedic Surgery. Not only that, he's the first person to perform the GPS, that is Guided Personalized Surgery for Bilateral Total Knee Replacement at Chennai. Furthermore, he performed total knee replacement surgery which was telecasted live at Arthroplasty conference held at Mumbai and Vapi. Joining on to the show, it's my pleasure to introduce Dr. S. Arumugam, a highly skilled proficient orthopedic surgeon who is based in Chennai. He's refining his skills for the past 25 years. Welcome, doctor. Yeah, so let's start off with simple explanation to the viewer, doctor. Sure. So, doctor, it's so common knee pain. Like everybody complains of knee pain, and earlier stage it was like people who cross 45, 50. At that point of time, they should say they are affected with the pain. But now what happens is even the youth population, they are getting affected by this knee pain. So, what are the causes of knee pain, and what leads to that?
Okay, so you asked a very elaborate question about what osteoarthritis is. Okay, osteoarthritis is nothing but inflammation of the joint. Okay. In India, if you see, the joint which gets inflamed more because of wear and tear is the knee joint. As you very clearly said, the age at which we were seeing patients earlier was much late, like early 60s or late 60s and early 70s is when we were seeing arthritis. But now, because of the lifestyle changes, the food habits and everything, we are seeing arthritis at a very young age. People in their late 30s and early 40s are already having knee pain. Well, knee pain, it all depends on when you're starting it. The first alarm bell that you will have is the knee pain that you have in the anterior part of the knee when you're climbing steps. So it doesn't happen once in a while. It happens almost daily. Every time you try climbing a fleet of stairs, your knee starts paining. This is in fact the first alarm bell that you will have saying that you're going to or setting in of arthritis is happening to you. So what you have to do at this stage is you have to start exercising. You have to start strengthening your quadriceps muscles, you have to strengthen your calf muscles and your hamstrings. So these are the muscles around the knee joint. So you have to go to a trainer or a physiotherapist and help them make you learn the basic exercises of the knee joint and start doing those exercises. If you do these exercises, your muscles will get stronger and the knee pain will gradually start reducing. But you miss the bus there and you start continuously walking, doing your work, eating junk food, sitting in the same place and working. So all these are the risk factors for osteoarthritis. So this gradually worsens and goes to the next stage, that is stage 2 of arthritis. Here what happens, apart from the anterior knee pain while climbing steps, you on and off keep getting swelling of your knee, and the distance the distance you are able to walk, that is initially if you are walking for 4-5 kilometers in a day, now if you walk 2 to 3 kilometers you start having pain and you get swelling on and off. This is when people usually come to us. So this is in stage 2 arthritis that patients come to us. And at this stage we give them analgesics initially to reduce the pain and swelling, and we also give them some joint vitamins joint vitamins which help them, sort of cool down the joint and nourish the joint. So this helps in avoiding or stopping the progress of the osteoarthritis from stage 2 to stage 3. Well, in stage 3 arthritis, the distance which the patient walks reduces further, and the knee starts slowly bending. It starts getting crooked. Usually it starts getting a small curvature inwards, so they will have something like a bow leg. So this happens in stage 3 arthritis. In this stage, patients usually will not be happy with just medicines, because if they take the medicine at that time, the pain will reduce, but immediately as soon as the effect of the medicine wears off, then the pain will restart again. So we cannot keep giving painkillers forever. So at this stage, we can give them intra-articular injections. These are injections that can be given inside the joint, and there are different kinds of injections which I will elaborate later. And if proper treatment is not given and things worsen and the patient goes to stage 4, the distance reduces even further. Just getting up, going to the bathroom and coming back itself is a task for the patient. The leg is absolutely curved and crooked and swollen. The patient is not even able to walk a few steps. Day-to-day activities is just impossible. At this stage, there is no other treatment that is possible except for knee replacement. So these are the different stages of osteoarthritis.
Okay, sir. You already told us the different stages of arthritis, but you haven't told us why this occurs. So can you just explain us a little more?
Good question. Well, to explain why this happens, I have to talk to you about the anatomy of the knee joint.
Okay.
Well, the knee joint is made up of the thigh bone and the leg bone. But what happens is, in between the bones, there is a cartilage which covers the joint. So this is called as the articular cartilage. This articular cartilage keeps the joint, sort of soft, and it gives a nice beautiful cover, so the bone directly doesn't come in contact with the thigh bone, doesn't come in contact with the leg bone. So there is no nerve innervation of this articular cartilage. I have told you about the different stages of arthritis. What happens is, initially the cartilage sorts of dries out, and there are small cracks that are formed in this articular cartilage. So this is the initial stage wherein the cracks are formed. Once these cracks are formed, there is bone which is underneath the articular cartilage which gets exposed, and that comes in contact, the thigh bone comes in contact with the leg bone. So this causes pain because the bones have free nerve endings in them, so they have the sensation of pain, and when they come in contact with each other, the pain occurs. So this happens in stage 2 or early stage 3 arthritis, but slowly the cartilage wear off goes on increasing. So if it is only small cracks, these cracks unite together to form a big tear, and huge surfaces of raw bone is exposed.
Okay.
So once this raw bone is exposed and bone on bone comes in contact with each other, the pain is so severe that the patient is not able to walk, and that is why the stage of arthritis slowly progresses to stage 4, and in stage 4 it is just impossible to walk.
That was an elaborate explanation, sir. You just explained it in a very simple way.